Chair. As usual, it's an honour to participate in this debate under your chairing. And what an extremely important and timely debate it is. And I want to thank all of those people who signed these two petitions that brought this debate forward today. For almost a year now, Covid-19 has impacted all of our lives in ways we could never expect nor imagine. Young people have missed vital time in the classroom, businesses have been forced to close, families have been kept apart. And shockingly, over 80,000 lives have now been lost. The correspondence I receive every day from constituents represents their vast and varied concerns. The common thread, however, is an overwhelming sense of fatigue and the desperate wish for the country to get back to normal. The vaccine is our way out, our golden ticket to some sense of normality. I'd like to put on record my gratitude to all those who've worked to make it possible. It should amaze us all that in less than just 10 months, humans have been able to learn about the virus, develop a vaccine to combat it, test it, conduct 3 phases of trials and get it approved. This could not have been done without enormous personal sacrifice, talent, and a level of international collaboration that should inspire us all and be applied to a range of areas. Because of their hard work, we can now see light at the end of the tunnel. The pandemic has demanded huge sacrifices be made by people all over the world in the name of beating the virus. Now that we have a vaccine, it is incumbent on the government to hold their end of the bargain and ensure that the rollout of this vaccine is done correctly. The stakes are painfully clear. If we can get vaccines to the people most at risk in the fastest amount of time, we're able to save countless lives. That is why, alongside the Daily Mirror and the TUC, my party have started the Let's Vaccinate Britain campaign. We are working with trade unions to demand that employers give workers paid time off to get vaccinated. We're encouraging people to sign up to the NHS, to volunteer, and speak to their friends, neighbours and relatives about the importance of getting vaccinated. And I call on everybody listening to this debate today to get involved in that campaign. Many of my constituents and others in Leeds are already contributing to this national effort. Fittingly, Leeds' first COVID vaccine was given to Sylvia Harris, an 80-year-old ward housekeeper who's worked in the NHS since she was 26. But has had to shield at home since March of last year. Soon she will finally be able to return to what she does best, caring for her patients. I'd like to thank Leeds United Football Club for offering their stadium, Elland Road, to be a vaccination centre, and to all those across Leeds devoting time and energy to making the vaccine administration possible. We need a huge national effort to get this country vaccinated, starting with key workers and those most vulnerable to the virus. This means we need to be conducting round-the-clock vaccinations, 24 hours a day, 7 days a week. It makes perfect sense for key workers to be vaccinated overnight, allowing daytime vaccinations for the age priority groups. Unfortunately, the Prime Minister said that there is no public appetite for 24-hour vaccinations. I would say that, unfortunately, I do not believe that is correct, and that key workers and people who need the vaccine and want the vaccine to get back to normal will take the vaccine whatever day or night is offered to them. Older age groups might not be prepared to do it during the night, so maybe the strategy is to vaccinate the key workers in the nocturnal hours and the older age groups in the daytime hours. So, well, I was about to say politicians across the House agree with us. And also, as the previous member said, I've been rightly keen to emphasise the importance of getting children back into schools and to declare my interest. I have a 10 and 12-year-old, and sometimes it's difficult to motivate them for home learning. I'm sure we all know that feeling. We cannot do that until it is safe, and schools are unable to operate in a socially distanced way or without access to proper PPE. Vaccination is the only way we can ensure staff are protected. But it's not just teachers that need to be added to the priority groups. I submitted a written question last week about hospices, and the Minister, who's in the chamber now, actually I think he's just finished in the chamber, so he can listen to this debate now and listen to what I have to say, responded saying the JCVI has based its advice on the data it's reviewed from a number of sources, including the ONS and Public Health England, and for the purposes of Covid-19 vaccine prioritisation, the definition of care homes as all care home premises licensed and registered with the Care Quality Commission. This definition does not include hospices. I'd like to ask the Minister on duty, and the Minister is hopefully watching, why not, and why hospices shouldn't be added because they're just as important as other care settings. I also want to make a plea for early years. Why are early years treated differently to teachers or other settings? They shouldn't be. And earlier settings are actually suffering at the moment because they're open and the financial pressures on them are immense because of the different pressures on their time. Today, the leaders of Leeds City Council wrote to the Parliamentary Under-Secretary of State for Children and Families, but copying in the Minister for Covid Vaccine Development, the member for Stratford-upon-Avon, and they said, the councillors Blake and Venner said, "We're requesting that earlier staff to include childminder staff working in group settings and wraparound care are prioritised for the Covid-19 vaccine. Earliest providers support a large number of children, provide personal care and do not wear PPE. It's of course vital the NHS and care home workers, as well as other priority groups more vulnerable to the virus, receive the vaccine first. But we are asking that earlier staff form an additional priority group after this. Another group who could be vaccinated in the evening or at night, putting our youngest away from harm in those settings." So I'd just like to conclude, actually, to ask about transparency on data, which was very gently touched upon by the previous member. We have a lot of data around testing. We know how many tests are being conducted in each local authority area. We know how many, where the rollout is, where the centres are. If we can have that level of data for testing, why can't we have it for vaccinations? I'm sure other members, apart from me, look on the Worldometer website. They've started recording vaccination data on there, as well as testing data, as well as cases, mortality, etc. So soon there'll be global comparisons around vaccinations, and we'll be able to see where the UK stands. Well, now we can see where the UK stands, but we need to be able to dig down, right down. We need to be able to see how many vaccines have been supplied to each PCN, how many centres there are, how many vaccines have been given first vaccine, how many vaccines have been given second vaccine. That will start to give confidence in the public about the fact that there isn't a postcode lottery, that rollouts are happening, that centres are open, and will encourage more people to come forward, not just for the efforts of receiving a vaccine, but for efforts of supporting the rollout. Data and confidence in the public is really important. I hope that the duty minister can take that away and we can provide with that data. I asked the member for Stratford-upon-Avon, this on a private call when we had the vaccine, or just before Christmas, and he said he'd get back to me. So hopefully now I've raised it in the chamber, he will get back to me. Thank you.